Knock. Hello, my name is Silva and I'll be a nurse for today. And I'm here to do your head to toe assessment. Is that okay with you?
Sure.
Alright, could you please tell me your full name and date of birth?
那生 September 6, 1980.
Alright, very good. Are you allergic to any medications or any drugs or any environmental factors,
No.
foods? No allergies at all? Very good. Are you in any pain right now?
No.
Alright. Let me just do hand hygiene and I'll be right back, okay? Could you please tell me what your height and weight are?
164 centimeters
Mhm.
and 120 pounds.
And I already asked the patient about their allergies. They said that they don't have any allergies.
No.
Alright. Now I'm gonna ask you a few questions to assess your consciousness, okay?
Mm.
Do you know where you're at?
Green River Hospital.
Okay. Do you know what today's date is?
Yes, March 14, 2025.
Okay. And who's the president?
Mr. Trump.
Okay. What brought you to Green River Hospital today?
Why I'm here?
Mhm.
Because I fell at home.
You fell at home? Okay. So I just assessed the consciousness of the patient. The patient is alert and oriented times 4 and able to tell me the information about why she's here at the hospital. And she has a positive mood, non-flat expression, appropriate for the situation that she's at. Her speech is normal. There is no deformities with her speech. Personal hygiene is normal and good. Now we're gonna move to the head and cranial nerve assessment. Would you like to stay seated for this?
Yes.
Okay. Now I'm gonna assess the patient's scalp. Is it okay if I assess your scalp?
Sure.
Alright, the patient's scalp is intact. There's no lesions, no patch spots, no bald spots. Hair is intact. The cranium is intact with no bumps or openings. And now I'm going to be checking the cranial nerve 7, facial nerve. So I'm going to ask the patient to please puff up their face. Very good. Can you please raise your eyebrows? Very good. Now I'm going to have you close your eyes and I'm going to touch your face with something and please tell me where you feel it, okay?
Okay.
Very good. So I just tested for cranial nerve 7 and this test showed me that her facial nerves are intact. She was able to feel the facial sensation, the movement, and it was symmetric. Now I'm going to be moving to the eyes. And for this, I'm going to take my pen light. Sorry, it's going to be a bit bright. Now I'm going to check the eyelids of the patient for any lesions, symmetry, and discharge. There's no lesion, there's no discharge, and the eyes are symmetric. Now I'm going to be looking at the sclera. So could you please, just gonna check with my gloved hands. The sclera is white. There's no jaundice or redness or blood splattered on her eye. Now I'm gonna ask the patient to, now I'm going to be, now I'm gonna check for the pupil reflexes. I'm gonna put a pen light on you, right, to see your pupils reacting. and her pupils are reactive bilaterally, and they're equal, round, and reactive to the light and accommodation. Now I'm gonna ask the patient to close one of their eyes, and I'm gonna ask them to read something. So could you please close your eye? Could you please read this?
I am Superwoman.
Very good. Can you close your other eye and read this?
I'm Superwoman.
Okay, now can you open both eyes and see this?
I am Superwoman.
Very good.
I wish.
Yes, you are Superwoman. Were you able to see the
Clearly.
letters clearly,
Yeah.
all three of the diagrams?
Yeah.
Okay, good. That means that the patient's visual fields are normal within normal limit, and that was testing for cranial nerve number 2, optic nerve. Now I'm gonna ask the patient to focus on this pencil, and I'm gonna be checking for the confrontation. So could you please focus on the pencil, and it's gonna come closer to you and away from you, okay?
Mhm.
There you go. Very good. The patient was able to do that with no problem, which means that it was within normal limits. There was no deformities. Now I'm going to be asking the patient to follow this pencil to check their extraocular muscles, which are cranial nerves 3, 4, and 6. So I'd like you to follow this pencil with just your eyes, okay? Try not to move your whole head. Very good. The patient was able to follow the pencil without any troubles, and which means that her ocular muscles are working well, and it's within normal limits and intact. That also means that her cranial nerve 3, 4, and 6 are intact. Now I'm going to be moving to the nose, and I'm going to be looking for any lesions, symmetry, and discharge from the nose. And her nose is symmetric with no lesions and no discharge. Now I'm going to be asking the patient to close one of their nostril and try and take a deep breath from the other one. Very good. Are you able to do the other way? Very good. Were you able to breathe in okay?
Yes.
Both times? That was testing for the patency of the nostrils, and the patient's nostril was patent with no trouble with inhaling. Now I'm going to be checking for the olfactory nerve, cranial nerve 1. So I'm going to ask the patient to close their eyes, and I'm going to ask them to identify a smell. Could you please close your eyes? Can you identify the smell?
Alcohol.
Very good. The patient was able to identify, you can open your eyes, the patient was able to identify the smell, which means that their cranial nerve 1, olfactory nerve, is intact and working. Now I'm going to be moving to the ear section, so I'm going to be checking both ears for any lesions, symmetry, and discharge. The patient has no lesions, no discharge, and both the ears are symmetric. And now I'm going to be asking you a couple of questions. Do you have any pain or ringing in your ear?
No.
No?
Both. No.
Both are good? Okay, very good. And this means that the patient doesn't have any tinnitus or pain present in the inner ear. Now I'm going to be asking the patient, do you wear any hearing aids?
No.
The patient does not wear any hearing aids, and I couldn't see any hearing aids on them either. Now I'm going to be assessing for cranial nerve 8, which is the vestibulocochlear nerve. So I'm gonna ask you to see if you can hear this, okay? Could you please close your eyes?
Yes.
Where did
Right
you hear
side.
it? Good.
Left side.
Alright. And now could you please stand up for me? And I'm just gonna check for your balance, okay? Try to keep your eyes closed, and I'm just gonna check for the balance for about 30 seconds. Very good. The patient is able to, you can sit back down, thank you. The patient was able to maintain the balance with no trouble. There was no swaying present, and she was also able to hear the tuning fork on both sides of the ear bilaterally equal with no treble. Now I'm going to be moving to the mouth and throat section. So now I'm going to check the lips and buccal mucosa for any lesions and symmetry. So let me just check your mouth. There's no lesions and there's no discharge, and her lips are symmetric. Now I'm going to be asking you to please open your mouth, and I'm just checking her teeth and gum. And her teeth and gum are good. There's no problems. There's no bleeding present. Now I'm going to be checking the tongue. So could you please open your mouth? All the no, just straight. There's no lesions. There's no cuts on the tongue. Now I'm going to be checking for cranial nerve number 12, hypoglossal. So I'm gonna ask the patient to please stick their tongue out, and I'm gonna just straight. I'm just looking for the symmetry. The tongue is symmetric, which means that the cranial nerve 12 is intact. Now I'm going to be checking for cranial nerves 9 and 10, and I'm gonna ask the patient to please open their mouth, and I'm gonna check the uvula. Could you please open your mouth for me? Can you say ah? Very good. And her uvula is midline, and when she said ah, her uvula went up, which means that the gag reflex is present. Now I'm going to be going to the next section, so I'm going to check the trachea for symmetry. And the trachea is symmetric. Now I'm going to be asking the range of motion. So I'm going to ask you to, if you could please rotate your head the other way, please. And are you able to turn to the sides? Very good. The patient's range of motion is good and intact with no trouble. Did you have any pain when doing that?
No.
Okay. Patient denied any pain or discomfort when doing so. So this was checking for cranial nerve 11, accessory nerve. Now I'm going to be asking the patient to shrug their shoulder when I place my hands on them. Very good. The patient is able to resist, which means that the cranial nerve 11 accessory is working. Now I'm going to be checking the patient's carotid pulse. I'm going to do one set at a time. Okay. Very good. The patient's carotid pulse is 2+ and it's bilaterally equal and it's strong. Now I'm going to be asking the patient to please lay down so I can check the jugular vein distension. Good. Are you able to turn your head to the left? And I'm checking for any pulsation. And it's absent, which is a normal finding, which means that the jugular vein distension is within normal limits. Now I'm going to be moving to the thoracic and abdominal assessment. And I'm going to start with the apical heart rate. Would you like to sit down?
Yes.
Okay, that's all right. I'm going to check the apical pulse. I'm going to check it for 1 whole minute. You ready? Okay. I'm going to put a timer counter for 1 minute. Very good. The patient's apical pulse was 65. Now I'm going to be auscultating the heart sounds. Do you want to keep seating
Yeah.
with us? Okay. I'm gonna first listen for the aortic. It's on the right side between the second and third intercostal space. Is it okay if I go under? Sorry, this is cold. S1 and S2 are heard with no murmurs. Now I'm going to be going to the pulmonic. S1 and S2 are heard with no murmurs. Now I'm going to be moving to the Earth's point. S1 and S2 are heard with no murmurs. Now I'm going to be moving to the mitral. Mitral and tricuspid. Here we go. Do you want to?
I'm okay.
S1 and S2 are heard with no murmurs. Now I'm going to the tricuspid. S1 and S2 are heard with no murmurs. Now I'm going to be checking the respiratory rate and rhythm. Do you mind putting your hand on your chest? Very good. Now I'm going to count it for 1 whole minute. Thank you, very good. The patient's respiratory rate was 20 and it was normal rhythm, which is within the normal limit. Now I'm going to be checking the Skin color and appearance. Could I please check your skin for the color and appearance? Patient's skin is normal, appropriate for the ethnicity. Skin is normal for appropriate ethnicity. There's no cyanosis present. Now I'm going to be checking the thoracic cage shape and configuration. Could you turn a little bit more that way? Thank you so much. And is it okay if I move your hair? Sure. Can you just take a deep breath in? Very good. The patient's posterior thoracic cage is symmetric. Now I'm going to be checking the anterior thoracic. Could you please take a deep breath in? Very good. The patient's anterior thoracic cage is also symmetric, which is within the normal limit, which is normal. And now the thoracic cage shape is normal, with the normal limit. There's no hunchback. The symmetry is within the normal limit. There's no scoliosis present. Now I'm going to be checking the tactile femoritis. So I'm going to be checking the anterior first. And I would like you to say 99 every time, okay? Can you please say 99?
99, 99, 99, 99.
Very good. Now we're going to be checking the posterior. Can you please say 99?
99, 99, 99, 99, 99, 99, 99, 99.
Very good. And I was just feeling for vibrations. You can sit back the other way. Actually, you can stay like that for just a minute. And I was just checking for the vibrations when she was saying 99, which was present, which is within the normal limit. Now I'm going to be listening for the posterior breath sounds. And usually I would go under the shirt. Is that okay?
I'm pretty sure you can hear it.
Okay. That's
Thank
all
you.
right. Okay, yeah. Could you please take a deep breath in for me? One more time, please. Very good. One more. Very good. Good. There was no normal sounds, no crackles, no wheezing present. Now I'm going to be checking the anterior bed sounds. So could you please turn to the other side for me, please? Thank you. And I would like you to please take a deep breath, okay? Very good. There was no abnormal sounds present, which means that there was no crackles or wheezing present, which was normal. Now I'm going to be asking the patient to please lay down so I can. Now I'm going to be asking the patient for, I'm going to be checking for any CVA tenderness. And please tell me if you feel any tenderness when I do this, okay?
No. No. No.
There was no tenderness present, which was normal. Now I'm going to be inspecting the abdomen. There's no discoloration, there's no scars present, there's no lesions present, which is within the normal limit. Now I'm going to be auscultating and the stomach looks, the abdomen looks symmetric. Now I'm going to be auscultating all 4 quadrants of the abdomen. Sorry, this is a little bit cold.
It's cold.
Sorry. Okay. The abdominal sounds breath. The abdominal bowel tones are present on all 4 quadrants, and it was normal active. And if it wasn't present, I would usually listen for 1 whole minute. Now I'm going to be doing percussion, so please tell me if you feel this, okay?
No pain.
Very good. And I was able to hear tympanic sounds when I was doing the percussion, which is within the normal limits. Now I'm going to be palpating all 4 quadrants of the abdomen. So please tell me if you feel any tenderness, okay?
No.
Very good. Which means that it was within normal limits and there's no abnormality. Now I'm going to be moving to the extremities, skin, and musculoskeletal system. Would you like to stay laying down or sitting down?
What would you want me to do? Yes, you can.
Okay. Now I'm going to be checking the patient's hand and nails. So could you please see your hands? Hands are warm to touch. There's no cyanosis. Fingers are warm to touch. Arms are warm to touch. Skin color appropriate for ethnicity. Now I'm going to be checking the capillary flow. Could you please see your hand again? Okay, the capillary refill on all 10 of the fingers were within normal limit, which was +3. And now I'm looking for any clubbing. Could I see your fingers again? There's no clubbing present, which is a good sign. And her temperature on the hand was warm. There's the trigger is within normal limit. The patient is not dehydrated. There is no lesions present. Now I'm going to be asking you to please close your eyes. And I'm going to be asking you if you feel me touching you with this and where you feel it, okay? Where did you feel it?
Right hand,
Okay.
left hand,
Okay.
left thumb.
Very good. Now you can open your eyes. The patient was able to feel the sensations, which was normal. And now I'm going to be asking the patient to please grip my hands as hard as you can. Very good. The patient is able to grip well, which is also within the normal limits. Can't see your. Okay. Now I'm going to be checking the brachial pulse. Could I please see your hand? The patient's brachial pulse are bilaterally equal and it was +2. Now I'm going to be checking the radial pulses. And radial pulses are strong, bilaterally equal, +2 pulses. Now I'm going to be checking the deep tendon reflexes.
Stress.
Okay, could you please try and relax?
Stronger. Yeah, it's okay. No pain.
Good.
I can feel it.
Okay. The upper extremity reflexes are normal. And now I'm looking for symmetry. The hands are symmetric, there's no deformation. Now, would you mind taking your shoes and socks off for me, please? Thank you. Now I'm just gonna be checking the temperature and color of the feet. The feet is a little bit cold. There's no cyanosis, there's no discoloration. Very good. The legs are okay with no deformities. There's no edema present. There's no discolorations, lesions, cuts, or anything present. The color is appropriate for ethnicity. Now I'm going to be checking the skin charter, the capillary ripples first. So. And the capillary refills on the toes are +3, which is within the normal limit. Now I'm going to be, I already checked for edema. There was no edema present. There was no lesions present. And could you please close your eyes? And I'm gonna ask you to please tell me where you feel this, okay?
Right side.
Okay.
Left ankle.
Very good. The patient was able to identify where the sensation was, which means that they are able to identify the lower extremity sensation, which was within the normal limit, and it was intact. Now I'm going to be checking the lower extremity leg strength. So I'm going to ask you to push my hands, okay? Very good. The patient has very good strength on their lower extremity. Now I'm going to be checking their dorsalis pedis pulse. The dorsalis pedis pulses are bilaterally equal and it's a +2 pulse, which is within the normal limit. Now I'm going to be checking the posterior tibial pulse. Which is also bilaterally equal and +2, which is also within the normal limit. Now I'm going to be checking the popliteal pulse, which is behind the kneecap. The popliteal pulse is also present, bilaterally equal, +2, which is within the normal limits. Now I'm going to be checking for mobility, so would you mind standing up for me? Are you doing okay?
I'm good.
Okay. Okay, I just want you to stand straight for me. And I'm just looking for symmetry. Very good. There's no deformalities. And the patient is symmetric. Now, the posture and position is good, which is within the normal limits. Now I'm going to be, while the patient is standing, I'm going to ask her to please do heel to toe touches for me, please. Heel to toe. Very good. And are you able to go there? Very good. Now I'm going to be asking the patient to, if they could walk on their tippy toes. Very good. Can you go on your heels backwards, please? Very good. The patient was able to demonstrate all of this. Now I'm going to be, while the patient is standing, I'm going to be asking the patient to do a toe touch. Are you able to bend over and touch your? So very good. The patient is very flexible and able to do the toe touch without any difficulty, which means that there's no deformalities present. Now I'm going to be asking you to please sit back, and I'm going to be checking for range of motion.
Sorry.
Okay.
No worries.
Are you please able to lift your legs up?
You said left. Sorry, the left
Leg.
side. Okay.
Very good. Are you able to go side to side? Very good. Are you able to rotate your legs? Very good. The other side. Very good. Are you able to do your feet? Are you able to rotate your feet to the sides? Extend and flex. Very good. Are you able to, I'm also going to check the range of motion of her upper extremity. Are you able to rotate your,
What you want me to
can you rotate? Are you able to rotate? Very good. The other way. Very good. Are you able to extend and flex your arm? So are you able to adapt? Very good. Are you able to flex your elbows? Extend your elbows. Very good. The patient is able to perform the range of motion without any difficulties, which means that the range of motion is within the normal limit and there's no abnormalities present. And now we're done with the head adjustment. Thank you for your patience.
You're
Is
welcome.
there anything else that I can help you with while I'm here?
you're perfect.
Alright, thank you so much. I'm gonna give the patient their call light and I'm gonna tell them if you need anything, please do call. Here's the call light. Now I'm going to be taking my gloves off and perform hand hygiene. Thank you.